All right, then. So today we're looking at comprehensive approach to managing diabetes. This is courtesy of the Healthy Living and Wellness segment of our Rjolad Hospital. And joining me in the studios this morning, Dr. Raphael Ibidapo, consultant endocrinologist with our Rjolad Hospital, is making a return on the program this morning. Dr. Ibidapo, nice to have you. Good morning.
Good morning.
And how are you doing?
I'm great.
Good. So the last time you were here, we talked about diabetes and we looked at it in detail. And I know that you gave us certain remedies, what we need to do. But let's start first with what our Rjolad Hospital is doing in terms of a comprehensive management of diabetes. What are you guys doing?
So we have a comprehensive approach to managing diabetes, starting from screening to diagnosing diabetes, and then arranging for multidisciplinary treatment to managing diabetes. So because diabetes is more like you need a comprehensive and multidisciplinary approach to treating diabetes.
Why is that so, really?
The reason is that the effect of glucose in the body, or high glucose in the body, it's actually, it affects every part of the body. When we look at the complications of diabetes, so it's not just for the endocrinologist to control the glucose. You may need the services of the ophthalmologist. Those are the eye doctors.
Okay.
You may also need the services of the kidney doctors. That's nephrologist.
Okay.
To help in managing people who have diabetes.
Now, is that to say that diabetes can affect these organs that you just mentioned, the eye, the kidney?
Absolutely. So, because one of the things we dread as an endocrinologist is for patients to develop complications of diabetes. We don't want that. So as much as possible, when they develop these complications, we need that multidisciplinary approach to addressing the issues that they may have and managing them properly.
Dr. Ibidapo, at what age would one come down with diabetes? Is there any age definition to it?
Okay, so there is absolutely no age restrictions or age cutoff to developing diabetes, because diabetes can affect right from the beginning of life till the end of life. So it can occur at any time of one's life. We've seen diabetes, neonatal diabetes. We've seen people who have who they just give birth to, and for one reason or the other have diabetes. So anybody can have diabetes.
So it's not age specific?
No, not
so at all. Anybody, I mean, someone who is 25, who's 20 can
absolutely
come down with diabetes?
In fact, nowadays we are seeing that the age of onset of diabetes is now kind of reducing. Yes. So initially we would, the normal age that most times we look at is the age of 40. So from 40 years and above, we could say, okay, this person may likely develop a type 2 diabetes. But now we are seeing 20-year-old, 22, 23 now having diabetes. So it's the age is quite dropping from what we used to know.
And this can be managed through lifetime?
Yeah, it's a chronic disease, so it's something that you manage throughout your lifetime. There's currently no cure, but you can manage it well and address those complications if and when they come.
All right, so let's rewind a bit, because I know last 2 weeks when you were here, you did talk about the signs and the symptoms. Yeah. So what are the things that will show someone that him or she might be coming down with some levels of diabetes?
Okay, so usually we talk about some of the three cardinal symptoms. The person may be urinating in large volumes. The person may also be thirsty. He keeps drinking water. And then keeps urinating large volumes of urine. And then the other thing is when you lose weight and you can't really pinpoint why you're losing weight. Those could be pointers. Another very important symptom they may have is what we call tingling sensations in the hands or feet. Because of the effect of high glucose on the nerves. So for most people, that may also be a pointer. Let me also say that sometimes diabetes may not give you those symptoms. In fact, some may just feel, okay, I'm having a bit lethargy, I'm a bit weak and all that. And when they go into the hospital and they have their blood glucose checked, they just see that the blood glucose is in the roof.
Wow.
So those are things that may just point your attention.
So when I check my glucose level, or perhaps the sugar level, as the case may be, what numbers should I be watching out for?
Yeah, so we usually, when someone comes into the hospital, usually there is a range of glucose that's usually between 3.5 to 5.6. That's the normal reading.
Okay.
By the time a person comes to the hospital with a fasting blood glucose greater than 7, then we usually would think that this patient or this person may have diabetes. So when it is repeated twice and the fasting blood glucose is greater than 7, then we may consider that person to have diabetes.
All right, so that's for the one. The normal one that people check around is always within the range of 80, 90, 100. So at which point will one say, wow, this is getting overboard?
Yeah, so at 126.
126?
Yes, once it's greater than 126 for your fasting, or it is greater than 200 for a random blood glucose, that means that the patient has eaten, he just walks into the hospital, and then they do a blood glucose check, and they see that it's above 200.
Right.
Then,
let's talk about the complications, or perhaps what could happen if someone fails to show up at the clinic for tests, and his sugar level or glucose level continues to rise. What are the consequences, Dr. Ibidapo? So
it has enormous consequences on the body, right from the head down to the toes. Right from it can affect the brain, so it can cause stroke, it can cause dementia, it can affect the eyes as well. So it's one of the leading causes of blindness in the world.
Wow.
It can also affect our hearts. It can affect the liver, the kidney. So, like I said, it's cut across virtually every part.
So all the internal organs could suffer as a result of heightened levels of sugar in the body.
Absolutely.
All right. One of the reasons people, or perhaps one of the causative factors, is the diet, our feeding habits, right?
Yes.
Talk to me, doctor.
That itself is a big issue. Nowadays, people tend to eat what they see and not really what they choose, because again, the notion that when you eat a lot of sugar, it predisposes you to diabetes may not completely be right, because we've seen people who eat sugary things and yet do not have diabetes.
You mean it?
Yes.
So they shouldn't be scared of taking sugar. Is that what you're saying?
No, but more to it.
There's a caveat to it.
Yes, more to it is the effect of both the environment and hereditary, that genetic factor.
Yes, so if you come from a family where diabetes...
Yes, so if you have that strong family history of diabetes, you must take care of your lifestyle, your diet, and look at you addressing that physical activity. Get yourself, physically active, and not be sedentary.
Dr. Ibidapo, if a family of let's say 7, right, and father, mom, both are diabetic,
yes,
is it likely that the 5 children will also come down with diabetes?
Yeah. So the risk of the children having diabetes is very high. We know that
all of them
may not have diabetes.
Okay.
But we know that type 2 diabetes in particular is what we call polygenic. Polygenic in the sense that it is not strictly by hereditary pattern alone. You also have the effect of the environmental factors playing a significant role.
Right.
So the chances of the children having diabetes is high, but not all of them may develop diabetes.
Right. Okay then. So some messages are coming in here for you, doctor. But you guys are the doctors, really. Do doctors also come down with diabetes?
Oh yes, we are humans.
you don't say. You come down with diabetes too.
Oh yes.
Okay. This one says, "Good morning, Traffic Radio. What are the early signs and symptoms of diabetes that people should watch out for?" Tubosun from Ikeja is sending that one in. I think you talked a bit about that.
Yes, so I talked about that. Sometimes, again, urinating large volumes should be a sign of a sign of worry. And then also, when you lose weight and you can't really, pinpoint why you're losing weight over time, I think that you should just go to the hospital and have it checked out.
All right. This one says, "Doctor, can pre-diabetes always progress to diabetes, or is it reversible? Thanks." You didn't put your name?
Okay, so pre-diabetes. In pre-diabetes, you were saying that the person has crossed above the values for normal, but has not gotten to the diabetic value. So that is just in between.
So numbers normal. Like 101, 110.
Yeah, exactly. Exactly. Okay. So the person is still in between. Now, for those who have pre-diabetes, it's what we advocate for is lifestyle changes, because we know that with lifestyle changes, those values, that high glucose can revert back to normal. So again, if the person is not careful, or the person is not diligent with the lifestyle changes, yes, it could become frank diabetes.
All right, Feisha is connecting with us. Feisha says, "Good morning. Are there any alternatives apart from insulin therapy for managing diabetes?"
Okay, so there are alternatives to managing diabetes aside insulin. Insulin is just one of the medications that we use to manage diabetes. So there are oral medications.
All right, and I want to help you clear your throat.
Thank you.
So go ahead.
So there are oral medications that we can use to manage diabetes aside insulin. So now we have quite a plethora of those medications. They are very good medications that we can use now.
All right. There's something called pile, right?
Yes.
Is that also a symptom?
No. So pile is a bit different from diabetes. The cause of pile, or the causes, as the case may be, are quite different from diabetes. Pile is as a result of you have protrusion of the anal region.
All right.
Okay. Either because again you are eating, but you're not taking enough fibers, and your stool is very hard. So that could force that area to just protrude.
Yeah. All right. This one says, "Good morning, Victor. Please ask your guest if excessive alcohol consumption can lead to risks of diabetes." Sammy from Opik is sending that one in.
Okay, so very, very, very good question. Alcohol is one of the causes of what we call secondary causes of diabetes. The direct effect of alcohol on the pancreas actually is what leads to can also lead to diabetes, because it can cause what we call chronic pancreatitis.
Okay.
So it's an inflammation of the pancreas, where the alcohol damages the cells that produce insulin. Okay, and we know that once insulin is not available, then the chances of developing diabetes comes in. So yes, alcohol, too much of alcohol is not good anyway.
All right.
Aside damaging the pancreas, it can damage other things.
All right. So, doctor, what would be the message now? What should people be doing, especially now that we're in the festive season? There's going to be lots of eating, right?
Absolutely. So my advice to people is eat healthy, eat nutritious meals, reduce the fizzy drinks as much as possible.
Okay.
Yes, take a lot of fruits and vegetables, and do your body wonderful things.
So the jollof rice, the party jollofs and all that, I can still eat that, right?
Oh, absolutely, you can eat
But
it's moderately, of course.
Oh, moderately is the word.
Yes,
But
moderately.
these days, hunger the wire man. So because the issue of moderation might be secondary to a lot of people at this time. Maybe they just want to fill up the stomach and then they're able to do the 101 or 111 as the case may be.
Yeah.
All right, so let's begin to round this off right now. Our Rjolad Hospital, you said people can walk in and
Yes.
do their test and
Yeah.
talk to me. What are the things that you guys are offering?
So we have a comprehensive healthcare when it comes to diabetes management. So you can walk into our accident and emergency or our outpatient department and ask that you want to check your blood glucose levels, and it will be done for you. So, and if there is any reason why we feel that your blood glucose is, or from the test you've done, you'll be appropriately counseled and educated on how to manage whatever your blood glucose is at that time, and also keep yourself healthy.
All right.
So both for screening and for diagnosis, we offer that. We offer those services.
And do you have personalized or individualized kind of care as well?
Absolutely, because the management of diabetes is individualized. We don't, one cap does not fit all when it comes to managing diabetes. So depending on what you're presenting with, that is the way you will be properly managed.
All right, then. It's nice having you in the building, Dr. Raphael.
It's
Ibidapo.
great to be here.
Thank you so much for being here. So,
Thank you.
our Rjolad Hospital, like he told you, they're offering a kind of multidisciplinary approach to managing a whole lot of diseases. And you can always reach out to them at 0700 0756 523. That's 0700 756 523. Or you can email them at WeCare. That's WeCare at rjolad.com. All right, WeCare at rjolad.com. Or you can visit www.rjolad.com or walk into any of their centers, the hospitals at Bagada, Isolo, and Agege, and they'll be there to give you attention. Let's switch gears right now. We'll be celebrating you, for those of you who are marking your birthdays, and after that, we'll swing to the next segment of the program.